Now we are starting. Sorry for those technical difficulties. This is my first time doing this. And today we're coming to talk about the coronavirus and global aspects. And unfortunately, this is hitting close to home to all of us. I think this is the first time in my life I've seen something that we can go anywhere in the world. But as I sit here right now, unfortunately, I hear sirens outside my window. And I know Elmira is in Brooklyn too. Elmira is living very close to me, maybe 2 miles, and we can't see each other. A good friend of mine, and we usually meet in the park. It's sort of halfway, and we don't do that anymore. I don't go out to parks anymore. I'm staying home. I haven't left my home in 9 days. This is sort of, I would say, it's sort of a sci-fi movie that we're living. And thankfully, we have 4 walls that we can live in, and not everyone's so lucky. We have to think that what's happening with homeless people now, what's happening with, New York is its economic level where it's being hit for many reasons. So we'll talk about some of these issues today, but we can also have room for more discussions in the future. So let me go ahead and introduce my speakers first of all. So we're starting today with Elmira Bayraslı, who is the director of Bard's College Globalization and International Affairs Program. She's also the CEO of Foreign Policy Interrupted, a platform to increase female voices, and the host of Project Syndicate's podcast, Opinion Has It. She is the author of the book, The Other Side of the World, Extraordinary Entrepreneurs, Unlikely Places, published by Public Affairs in 2015. We're also happy to have Ilan Ben Sion, who is a Jerusalem-based staff reporter with the Associated Press, and a freelance reporter whose work has appeared in the Financial Times, Wall Street Journal, Times of Israel, and El Monitor, among other publications. Next, we have Raquel Sezer, who lives in Istanbul and has recently published a book, which is in Turkish entitled Multici, Bir Aktivistin, Multici Kampı Tanıklıkları, Refugee and Activist Testimonials in a Refugee Camp. She's a regular contributor at the Turkish online newspaper Gazeti Duvar. These are all in addition to her work as a clinical research organization. Last but not least, joining us today is Cahan Kizil. He is an associate professor of neuroscience and genetics in German Center for Neurodegenerative Diseases with Helmholtz Association, and he has additional affiliation to Technical University Dresden. His research culminates in interdisciplinary approaches harboring genetics, neuroscience, cell biology, neuroimmunology, very difficult to pronounce some of these. In 2019, he became the first to receive a tenure professor in DZNE Dresden, Helmholtz Association. So first of all, welcome to all my guests. It's a real, I think, incredible moment that we're able to talk with so many people throughout the globe right now. So thanks for being with me. Let's go ahead and, Elmira, we can start to talk for a few minutes, and each of us are going to talk for a few minutes, and then we can have a conversation among us. Elmira, I've known you for a few years here now. We're good friends. We're stuck basically in our homes, like so many people throughout the world. And really, as they say, Lisher Babayit in Hebrew, Evde Kal in Turkish, all these things, stay at home, right? How do you assess what's going on, or how can we even understand what we're going through, both internationally and locally? I mean, many of us here have got used to lives where we jump on planes, we go back and forth. I'm someone that lives in 3 cities, Istanbul, Tel Aviv, and New York. My daughter's in Tel Aviv. I just can't, for the first time, we can't just get on a plane. Airports are closed. Turkey's closed off to the world. It's happened in many, many places. How do you assess this, and what are some of your thoughts of what we're going through?
Well, first of all, thank you, Louis, for organizing this discussion. I think it is, I think it's an important moment for all of us together all over the world to be talking about the various aspects of how COVID-19 is impacting our various communities. And I think, as you pointed out, we used to be able to travel all over the world. I'm somebody who would regularly get on an airplane and go to somewhere in Africa or the Middle East or Europe or in Latin America. And now we are confined to our homes. And I think for me, the two things that really come up are the fact that we've always been very aware of how globalized and connected we are with the world has been very apparent. I think all of us have friends. Everyone here certainly is connected with someone outside of their home countries and was able to go to different places. And yet at the same time that we're so aware of how globalized we are, we also have very much ignored how vulnerable we are. I think this sense of globalization has given us this sense of invincibility, which is really coming down right now. We heard about the COVID-19 virus in Wuhan, China in early January. And yet the United States failed to adequately not only prepare on a medical and resource aspect of preparing for this virus, but I think that there was a general mentality in the United States that, well, this won't really affect our population for some reason. Americans, for whatever reason, are invincible. And we live in the superpower. We have the strongest economy in the world. We have the best military in the world. We're an advanced first world country. And now we're seeing how no matter how strong your economy is, how great your innovations are, how we all of us, regardless of whether you are in China, in India, in Nigeria, in Turkey, in Germany, or in Israel, that we all are human and we are all vulnerable to what happens in one part of the world, and how we not only need to pay attention to what is happening there, but understand it and respond as a global community.
Yeah, you know what you're saying, I think is so important. And I think it so reflects what happened here in the United States with this idea is that, and I usually don't use in my class, we, but the quotation, we are the strongest, this won't happen. And the huge divide in the United States, I have to put in that I think in New York, we at least have the New York State administration, via Cuomo and other people, have at least sort of in the last 2 or 3 weeks they put themselves in damage mode. And when I heard about the field hospital opening up a Javits Center, just as someone living here, and I'm not really connected to New York anyways. I come here to work for years, and the last 2 or 3 years it's become also a home. But suddenly I say, oh, wow, there's a hospital opening up in Javits Center. If something happens to me, there's a backup plan. Versus other regions we're going to be talking about today, where they're in, I don't want to say la la land, but they're in complete denial of what's happening. Florida could be a good case where, they still don't have a stay-home policy, as far as I know. And so I think this idea of, the idea of making us feel small again, this idea also, personally, many of us just hopping on planes back and forth, and suddenly we're confined not only to a nation state, right? Not only to a nation state, not only to a city nation state, but also to our 4 walls. And later we can talk about the sense of community that might be emerging from this. As a New Yorker, Elmira, how are you dealing with, or how do you think New Yorkers on the local level have been dealing with this?
I think this has been a huge shock for New Yorkers. I was born and bred in New York. I'm a lifelong New Yorker. And I think that there is always this sense of our subways are open 24 hours a day, 7 days a week. It's a city that doesn't shut down. Obviously, we are the financial center of not only the United States, but pretty much of the world. And I think that there is this sense of, again, that word invincibility
Mhm.
that I keep being reminded of. And I think New Yorkers are very much in shock. When 2 weeks ago, after President Trump made his Oval Office address about the seriousness of COVID-19, and there was all of the shutdowns, we started to see universities shut down, Broadway was shut down, a lot of things in New York just going dark. There was still this sense in New York City that, well, this won't affect me. I went out that first weekend for a walk. I live right across the street from Prospect Park, and I was shocked at how people were having picnics and
I
playing
remember.
ball. And then walking down on Vanderbilt Avenue in your neighborhood, Louis, and people were packed in restaurants. And I thought, they're really not taking this seriously. Like, this is an extremely contagious virus, and everybody's going about their lives in such a normal way. I have to say, I think in the past week, I think it's really set in as more and more people have become infected. And as you pointed out, all I hear now from my apartment is sirens, the constant hum of these sirens. And I think people are really starting to get a sense of, this is much more serious than we had originally thought.
Absolutely. Thanks so much, Amira. Elon, uh, Jerusalem, Israel, Palestinian territories, they, I think, felt or caught, at least in Israel, you could see that there was a clear policy of containment, well thought out. And something happened about 2 weeks ago, and I think people put it around the Purim celebrations, where one night, Purim is a great holiday for secular and religious alike, for among the Jewish community. And they went out and had parties. And suddenly we see the number rising, and we see that the state, although implementing very, I think, stringent policies that really started to show results, they haven't had a across the board policy that's really clear at the same time. Could you explain what's happening both in Israel and also to look at Palestine, the Palestinian territories, occupied West Bank, and in Gaza? Yes.
Absolutely. So thanks so much for having me on here and for hosting all of us on this discussion. So Israel's health ministry said today that the number of infected people is up to 3,865. And today alone, there were 3 deaths, bringing the number up to 15. And the implications for this have been pretty widespread. I don't know whether we can necessarily say that the spike in recent weeks has been a result, the direct consequence of Purim, but the Israeli government, starting from late February, had already started imposing pretty stringent policies in terms of requiring people to self-quarantine if they return from abroad, barring foreign nationals from entering the country from what became an increasing list of states, and then eventually just a blanket ban on foreign nationals entering the country. And from the get-go, there was a pretty aggressive stance towards trying to contain the coronavirus and its spread in Israel. But as in the past couple of weeks, these regulations, as they've grown more and more stringent, they've come in staggered phases rather than putting a blanket lockdown on everybody 2 weeks ago. It's been a gradual incremental increase, which has led to some confusion. One of the really interesting points in terms of Israel has been the issue of non-compliance by some, albeit a very small minority, but a portion of the ultra-Orthodox population who have refused to follow regulations requiring people not to gather in large groups. Last night, I believe there was a video of many hundreds of people taking part in a funeral in the city of Bnei Brak, just outside Tel Aviv. So this has been a major issue and a concern of both health officials and politicians here, that this non-compliance among ultra-Orthodox is going to result in an enormous outbreak within that community, which could further affect the broader population. There's also a major issue concerning underreporting, both among the ultra-Orthodox and among Palestinians, whether in East Jerusalem or in the West Bank. And the Gaza Strip is obviously a somewhat different situation. At least right now, the circumstance is that there are 97 reported cases in the West Bank and 9 in the Gaza Strip. There's been 1 confirmed death in the West Bank from coronavirus. But as I said, there's a social stigma that has emerged of reporting potential cases of coronavirus among Palestinians. And there's a general concern that the number of cases is actually far higher than the official figures that are being reported. And this is deeply concerning. The West Bank's healthcare system is already not nearly as advanced, for example, as Israel's or a lot of countries in the West. And if there is a major outbreak in that region or in East Jerusalem, or certainly in the Gaza Strip, this could be a serious problem. One of the other issues that has sort of come up in Israel, the unemployment rate has skyrocketed in the past month, as it has in many other places. Unemployment is now over 20% because the current regulations that have been in place for about a week or so require that people remain at home unless they work in essential industries and essential jobs, and they can only go 100 meters from their residence unless they're out buying medicine, seeing a doctor, or purchasing food. This has impacted a number of industries, particularly Israel's tourism industry, which has been one of the most flourishing in recent years, with tourism numbers going up and up and up. We have the Passover and Easter holidays coming up in just in the coming weeks, and the entire industry has essentially been wiped out, along with many others. And this is going to have an enormous impact on Israel's economy, which will have further knock-on implications for the economy of the West Bank, which has also been crippled by this crisis. And politically, one of the big implications is that the political deadlock that we've had here in Israel for the past year has suddenly shifted quite a bit. In the past several days, Benny Gantz, who was a rival to Benjamin Netanyahu in the past 3 elections that we've had this past year here in Israel, he has decided to join Netanyahu and form an emergency government, which the official word of which we're still waiting for. But if such a government is formed in the coming days, it would put an end to a year of political stalemate. And the logic behind it was, at least as Gantz has explained, is that at this time, with the coronavirus crisis in full swing, Israel needs a government that can pass budgets, that can fully address this issue, and that the matters of petty politics or disagreements over political issues have to be put aside in order to address this full on.
Mm-hmm. Perfect. One last thing before we move on to Raquel and Jahan. I know personally you were in quarantine yourself. You came back from outside of the country, and I think how many days were you put in quarantine? And if I understand, they can come and check on you. The police can come and check you, or bureaucrats can come check. You want to tell us real fast about that?
Sure. About 2.5 weeks ago, Israel imposed a blanket requirement for all individuals returning from abroad to enter a 2-week quarantine, 14 days. Today is my final day of quarantine, and under the regulations, for the health ministry inspectors and police can check on individuals who are registered as returning from abroad in order to ensure that they are abiding by the rules of quarantine, with punishments being as much as about $1,500 for people.
Wow.
So after
Okay.
2 weeks of being indoors, I'm very eager to go back to work as a reporter, and obviously limit the amount of time I'm outdoors and exposed, but you know, to keep covering the story.
This is where reporters are needed and journalists are needed to be out also. Thanks so much, Raquel. You live right in Beyoğlu, dear friend of mine for over 2 decades now. You live right in Beyoğlu. Tell us a bit about Istanbul and some of your concerns, and yes, with your expertise also in your profession, and with your your social work that you've been doing, social activist work you've been doing for many years.
Yeah, thank you, Louis, for inviting me to this discussion, and it's been great so far, the discussions that I've been hearing. And so the impression in Turkey is mainly confusion among the people, simply by the statements of the government, that the people, were hesitant to take it as, not to take it important or not important. Is it a minor thing to be concerned, or a major, or are we in crisis? First is, I agree with Elmira's comments on, we also thought in the beginning that, it will pass Turkey, this virus definitely will pass, because it arrived. The first cases actually was identified on 11th of March, and first we experienced the first reported death was 13th of March. So till that time, this wasn't a priority in government agenda, let's say. And so after the first reported death, we were optionally, advised to stay home, and there isn't any blanket requirement like in Israel, or for the people coming from international venues. They were advised to stay in, but nothing like fines or anything like a police will come in, and it can come in anytime like that. But they are responsible of themselves. So till now they've been giving advices that everybody is responsible for its own health, and also economic impact. It's, the government, I can understand also from economic point of view, since Turkey was hit so hard last year already, and we had like 10 to 13% of unemployment, government were hesitant to impose people not to go to work, basically.
Absolutely.
So I mean, in Turkey, it's not very much people can work from home, mostly factories, and that people has to go to daily jobs that otherwise they don't work. And the government were hesitant to announce an economic package that would be, that would be agreeable for all the parts of people, all the walks of life, that society. And finally, when was it that the economic package was announced, but that was still, brought a lot of criticism, because among the economic package there were some irrelevant aspects, like, for example, the president was saying that he's going to lower the domestic tax on the Turkish flights. I mean, domestic flights.
This was last week, correct?
Last week, yeah.
Yeah, exactly.
And some mortgages were, the loans were kind of, the down payment would go
Extended,
till 10%. So it's still, not taken seriously, with the economic package having like irrelevant aspects also.
Yeah.
So, you know, there's like contradiction between, like, for example, when the first death was reported in Iran, you know, after only, you know, a week after, there was, you know, flights were banned from Iran and the land border was closed. But yet, I mean, the government allowed people to go to Saudi Arabia for pilgrim, for Umrah.
Yeah, yeah.
You know? And then when they arrived back, you know, they all arrived back as of by 15th of March. They all came back, 21,000 in total for this within couple of 3 months, within 3 months. So only because of the public criticism, they only could contain 5,000 of it. But the rest, you know, when they arrive from pilgrim, you know, the tradition, you know, people has to gather in their houses, in the individual houses. And this was like, you know, although they were advised to quarantine themselves after the fact, you know, the invitations, all these gathering took place anyhow.
Yeah,
So
and
it's
just
like,
for those who don't know, that the Umrah is basically when you visit the holy sites in Mecca. That is not during the normal Hajj the period. So it's a very holy event that people come back, and when they come to home, guests will come and visit them and welcome back from the holy cities. Raquel, as someone that lived in Beyoğlu, last point before we move to Chahan, how is it walking through the empty streets? I saw one of your posts, and you know, the time it reminds me of, unfortunately, was way back in I think 2003, bombing and the 4 bombings, that massive bombings that closed down the city for about a week. Where the streets were absolutely empty. One of them hitting the British consulate and the Neve Shalom synagogue, both spaced over time, when 2 different bombings, 2 synagogues, and then HSBC and up in Levant and the British consulate right in the heart of Beirut. Streets were empty, I remember, closed down. And now this is a total closure. What is the sense you're feeling, or what's something personal before we move to Jahan?
I mean, Istiklal, it's really, I mean, we used to complain about, you know, there's, you know, lots of tourists flocking in, and, you know, it's so crowded that the locals cannot take a breath, or, you know, everything. But now it's all the opposite. You know, we miss the tourists and the crowd, and it's basically, it's sad to see, and it hit Istiklal most because, you know, all these coffee shops are there, and there's not much of a, you know, like we have some shops, you know, for clothing, but, you know, it's not a busy street on the sense that people would go regularly for grocery shopping or something. So, for example, the closest neighborhoods like Shishli, Osman Bey, where it's more of you know, your daily activities, it's still populated, you know, it still have some crowd, but Istiklal is totally empty. I took a walk yesterday from Istiklal to Taksim Square, and but, you know, a good news is the air was so fresh.
Yeah, I think that's what we can talk after, is the what, bringing back what Amira said, that we've got used to this life. We've also got used to a life of polluting the world, and suddenly you're seeing these satellites with clean air. So there is this idea of, when I say coming back into the home, coming back to the small communities of home and family, also to see that we're also saving the world in some strange way in this age of global warming. Thanks so much, Raquel. Chahan, you have a special, unique view, because you're working intensely also on what's happening in Turkey. You're one of the key people speaking about what the government, writing very, very strong messages of what they need to do. You're saying stay home, lock down this. You have different, and this is, I've been following you for a few weeks, seeing this. But you also live in Berlin. You also understand a different way and what's happening in Germany also, that's been contained much differently than it has in other places. So if you could speak for a few minutes about putting those together, your unique view of Berlin and Istanbul, which are, let me tell you, they're in a very weird way, sister cities in that sense. The flow between Berlin and Istanbul just goes back and forth. But the outcome of this, one is more contained with a very high number of coronavirus cases in Germany. But I'm very afraid that Turkey is following the American model or the Italian model, if we want to talk about models. And I'm gonna backtrack on that. And let's not call them models because I don't know enough to say it's Italian model. But I know in the United States, there are some very strong similarities. So Johan, share with us some of your experiences, please.
Thank you, Louis, for the invitation. I think it's great to be in such a group and discussing the global aspect. Well, actually, since the start of the epidemic first, but then in March 11th, it became the pandemic declaration. I think some countries have been following the general guidelines of the preparedness plans and the critical planning and projecting what is to be coming or some other measures. For Germany, the first case was in January 26th, which is like only 2 weeks after China declared the outbreak. So from the very beginning, I'm working in academic institutions and also affiliated with the medical faculty. So we were informed from the very beginning about what could be coming and what is the plan and what's going on. Of course, in the beginning, so you are not prepared for such a big emergency plans and what's going on, what's going to happen. In the first days, we tried to adapt to the conditions in Germany, or how is going to be with the working, should we reduce our working hours and everything, these naive questions. What we are now, after almost 2 months, is almost a complete lockdown. For instance, the city I am in, so there's a lot of, it's called the Ausgangssperre, but the English word could be a curfew or a lockdown, so whatever you call it. So, but what I would like to underline is that there's no models in the world. There are precautions, there are measures, there are local measures, and every country did projections according to their own local dynamics and came up with plans and came up with actions. But I think the overarching question here, or the take-home message, was Mike Ryan's, the World Health Organization's director, also formerly in the Ebola cases. There was a video for 2 minutes, and he was saying, well, act fast. Even if you are wrong, you have to act fast. If you wait for the perfect moment to act, then it's the worst moment because the virus will get to you. And some countries, as we can call, let's not call them models, but maybe the failures are at this situation. But some countries are still hanging in. And I think Germany is one of them. So from the very beginning, as I said, the information flow, the plan, and the legal regulations, for instance, the infection Schutzgesetz, the infection protection law came into effect. And we were told that this, since the Second World War, this wasn't in action in such a big emergency plan, so no one was knowing. But it came into power and brought the Robert Koch Institute, which is the leading virology institute and the scientific institute, into an extraordinary position so that they could impose on even the states what to do. And so it was a scientific input. And day by day, this was evaluated. And the biggest, I think, the plus for Germany was the number of testing and the case following the cases. If you are positive for any tests, you are quarantined, it's a law, And that quarantine is determined whether it's at the home or if it's severe in the hospital, but you give names. You give names of the people in the last 2-3 days you have contacted in a certain duration, 10 minutes, 15 minutes in a contained area. And then these people are tested too. I think this brought a very early protection towards the spread. Still, now there's more than, I think it's 60,000 cases in Germany. It's escalating, it's going up. But if you look at the death rates and also the capacity usage of the ICU, it's low. It's one of the most successful cases. Is it going to go like this or not? We'll see. The precautions are there. But if you look from this perspective of containment, quarantine measures, case following, and increased number of cases, and the transparency, I think Germany is following a different route compared to the other European countries. And also, it's similar to China, but it's not as massive as lockdowns or building hospitals, which was an amazing thing China did. But Europe and many countries don't have this opportunity. And Germany followed its own course, and it seems to have worked so far. If when I compare this to Turkey,
what's your, you and I have been comparing, what's your assessment of Turkey? I know that you've been writing quite a bit about this and studying in depth. What's your assessment of Turkey now? Because unfortunately, a lot of people really feel, and I think Raquel highlighted this a bit, that it was there before March 9th. You know, Turkey borders Iran, northern Iraq, Greece, a great Istanbul, the #1 hub for Turkish Airlines, flying more places to the world than all these other places. We had the Umreh case, we had many cases. So what's your assessment of Turkey today? And unfortunately, where do you see it going? I don't like worst case scenarios usually, but I think we're past that, in the United States, where we didn't like worst case scenarios. And, there's going to be over 200,000, there's going to be over 300,000 in the United States, it looks like, the way it's going. So what's sort of your suggestions that Turkey should, what's your assessment and your suggestion that Turkey should take now?
Yeah. If we give a little bit scientific background to this, from the very beginning, the modelings and the studies have shown in different countries, and this is consistent, that the virus entered those countries, or the outbreak started at least 30 to 50 days before the cases were reported in higher numbers, because the initial cases, one, could not be detected. Second, was not within the statistics that normally people die of pneumonia, people die of respiratory syndromes, but you wouldn't count them as the COVID-19. And in China, this is believed to be in the late December or maybe early December. In Italy, the modeling shown that 1st of January was the entry time, but the first case came up in February 20, and this is consistent in Germany the same way. So it seems like the dynamics, if you look from the epidemiological dynamics, this virus entered every country long before the first cases were even realized. So the Turkey declared the first case on March 10th, I guess. It means that it could be the early February with very parsimonious way of speaking. The mobility in this case wasn't cut down. So we can think that we are not in Turkey in the early stages of the outbreak. It's now the middle or even maybe the later stages, because this is important to project and agree, because there are measures that you can only take in the first stage, which is like telling people to stay at home or telling them to wash hands, or maybe slowing down the social dynamics, or minimum operation mode for many factories, whatever. But in the second phase, you have to take more radical measures. And in the third phase, if you don't take anything, the measures will impose themselves on you. Look at Italy, Spain, France. You have to lock down the whole country. But in this case, you still lock down the country, but you can't stop the progression. So I think Turkey might have had a chance, given that the timeline of the outbreak. But I think in the last 3 weeks, these shy measures, like slow steps towards the lockdown, I think this might have exacerbated the whole thing. And as we all discussed, the mobility, the pilgrims and other people, not only them, so everyone. I mean, the young
And
generation.
people coming back and forth from
Exactly,
Europe. I mean, there
everyone.
was
They go to
daily, how many flights do you have from Germany to Turkey? You have 30 or 40 probably every day.
Yeah,
People coming in and out.
Yeah, they were stopped, but the flights from New York to Istanbul stopped only 2 days ago or
Exactly.
yesterday. I mean, can you imagine a hub, New York, and so these were the mistakes. And I think at this point, I always say we don't have pharmaceutical intervention opportunities right now. So it's developing. Science is doing good, but we are not there yet. So what could be done is lock down the country as much as possible. It doesn't mean that everyone will stay 14 days at home or 1 month. So there might be a minimum operation mode, which could be decided, which could be backed up with some economic plan, plus do a lot of tests. The test numbers in Turkey is so low. It's per day, now it's 7,000, but in Germany it's 200,000. In Italy, even it's like that. So
in New York, let me add that New York was testing much higher than the other places in the United States. It's one of the first things that they set in. And then we see I mean, some people say, well, only when the tests go up, then you see how many there are. But there's still a correlation with tests and then hospitalization, which I think we haven't talked about, but the hospitalization numbers are really where we should look at. And the death per million on the countries also. US is still low, but it's climbing up steadily to reach us. Yes, please go ahead.
Absolutely. So, I mean, having a containment strategy, whatever you call it, plus high testing and supporting the health system and your health personnel and your equipment, which is basically the limiting factor that can decide between a catastrophe or a success. So in either case, this is not something that the political reflexes are used to, because biology doesn't listen to you. So the virus doesn't listen to your economic constraints or your motives. It runs its course. You have to take action and you have to get adapted to this. And I think some reflexes are basically it's more on the other side, but some reflexes are maybe more on the human life side. We'll see. Turkey at this point is taking measures which could be in an isolated case could be said could be named as positive, but I think the stage of the disease is not appropriate for that. So these measures should have been taken 3 weeks ago, but now there should be more radical measures, which is for the sake of everyone, for the sake of the economy even. So this has to be done. I think this is what.
Yeah, you know, what I sort of noticed about Turkey is I wrote in a long tweet about last week, a thread, and I said, you know, they're jumping and they're doing the right hoops. They're even doing the right steps a lot of times. I think Erdogan's speech last week, you know, it started with almost 10 minutes of what we have done until here. But I don't think the politicians get it. Meaning they're doing the steps that need to be taken without understanding the enormous situation that they are facing. So it is a mixed message. I think stopping the travel between cities was something outstanding. And, you know, New York, and we now can maybe, thanks so much, Shahan. How long are you do you go out anytime, real fast, personally? Do you get to go out? Do you go out once a day, or how is your personal, before we move on?
So personally, we are allowed to have some small walks for health reasons, or if you get special permissions, you can even go to work, but our institute is on minimal operation mode. Maybe 5 people are taking care of essentials. I'm not going to, I'm home officing. So every 2-3 days, I go out maybe 10-15 minutes, and not to starve and get something to eat, but that's it.
I haven't left my home 9 days straight. I think in the 14 days, I remember what you said. I was one of the ones visiting one of those restaurants 2 weeks ago. And I walked in, I said, oh, I'm so stupid. I had already put myself in, but I said, I want it one more time. And now today, it makes 2 weeks that since I visited that restaurant. I'm not going out because I'm afraid. I live on the 19th floor and I'm afraid of the elevator you know, people, you know, you cough in that and you get it 30 seconds later. It's not even touching it. It's the air even, you know what I mean? So walking up 19th floors is not fun. So I've completely closed myself in. what before we have about 5-6 minutes, maybe 10 minutes. I don't want to keep you all, and I think this has been so productive. What perhaps questions between you? I don't want to hamper or prevent you guys asking each other questions. So let's open this up for discussion. What do you think we can learn from these global aspects, which were highlighted so well at the beginning? You know, some of the Elon, what do you think globally? What do you think? What does this mean?
To say that this is certainly disrupted the global village that we've grown so accustomed to living in, as we've all mentioned in our own way, and that certainly it's going to take quite a long time, even after the first steps to recovery on a societal scale start being taken, for things to go back to the earlier paradigm, early January 2020.
Yeah, it's going to be. And Raquel, I know you've done your book is on working with refugees. Turkey, of course, is hosting millions of refugees. Some of them very long term. Many of them, you know, very early on had hospital access, but there's still, you know, I believe still thousands of refugees on the Greek border as a result of political developments with Syria. Actually, about 4 weeks ago. What do you say? I mean, refugees are one of the most vulnerable communities, and maybe after that I'll ask Jahan about other vulnerable communities.
Well, actually, in the case of Ministry of Health reporting of the cases, he still refrains from naming the locations of the cases. You know, so
the Minister of Health you're referring to, yeah.
Ministry of Health, yes. Let alone Fahrettin Koca. We don't know anything about the locations. There are rumors that people, you know, talk to each other. Oh, I knew him, you know, he was the friend of friend, and he lived there. And we have no kind of, you know, not us personally, that now that, I mean, government is telling us that you are your own, you have to take your own measures. And we have to know where those people lived, or you know, that might got quarantine or something. We don't have any naming of locations reported. Now
including deaths in hospitals.
Yes, we don't know which hospital that the cases are. So with the refugee cases, of course, as you can imagine, that we don't know any numbers reported from the refugee camps. The latest news I got
is taking place. Do you know where testing is taking place? As far as I know,
testing in the refugee camp, you mean?
No, testing in general across where the tests are actually being taken.
It's mostly the big cities. I don't think any testing. I mean, we only reached to, you know, we are far below what, you know, Chahan's numbers, about 200,000. We are like only like for a week now, and since we started testing and the first cases came in, we only reached to 30,000 maybe. It's so slow. It's so slow. So yeah, I mean,
I believe it's 50 or 60,000. It doesn't matter. Even if it's 80, even if it's 100,000, it's a drop in a bucket in a country that's 80-90 million people.
We have to have reached 1 million already testing wise, because we are such a populated country, and you know, we have all this, you know, mobility, as you mentioned, you know, till only yesterday the flights were canceled for New York. We had to do that. And for the latest news on the refugee front, by the Greek border, they have evacuated more than 5,000 people, refugees that was camping there. And they, after the 14 days quarantine, they have distributed them to 9 provinces, the camps.
Okay.
So
And remember that they bust them, many of them were bused there by different groups, and I don't want to get into that, but they were taken there to the border, and now they're being taken back and dispersed in new places, which is a tragedy, all over, and they're going to be bringing,
now it's more tragedy because those refugees who were bused there, they lost everything. Now they are back to zero, back to the camps, back to maybe the first time they came to Turkey, back to the day.
I got it. They're very, very difficult. Amira, before we come back to Jahan, Amira, what do you think about the vulnerable communities? I know I unfortunately don't have it right now, but the map of New York City shows that there is a gap between the haves and the have-nots. Could you say something about that?
Sure. I mean, the most recent map that the city of New York distributed showed the rate of infection, and from the least to the most. And of course, when you take a look at the wealthiest neighborhoods in New York City, the rates of the least infection are on the Upper East Side, on the Upper West Side, in Greenwich Village, where incomes are very high. Where the highest rates of infection are out in certain areas in Queens, in the Rockaways, in neighborhoods like Sunset Park and Borough Park, where you have large immigrant communities, people who don't have the luxury of working from home. And, this causes a problem because on the one hand, I am very much an advocate for stay at home, do what you can to stay safe. But then there is also the reality that people will be economically affected by massive closures of restaurants, of shops and retail places, and people have to work. And New York is a very expensive place. And, it's very concerning that we're also approaching this crisis from a purely economic lens rather than a health one. And we're creating this black and white dichotomy where, it's either we have to save the economy or we save people. And it's just, I don't understand why we can't do both. And I don't understand why we haven't been doing both for a very long time.
Very, very, very important statement. Chahan, to sum things up, and then I'll say a few words quickly. We're quickly coming out of time. We've stayed a bit longer, and I think once again, this has been so important. This will be also uploaded later on to my YouTube page, and I hope people will be able to watch it and hear some of these global challenges. Yes, Chahan. Some of the vulnerable communities, or anything else you wanted to add?
I think vulnerable communities come with different flavors, but the prisons are also one of the many one of the important places, because history showed every pandemic, every epidemic, every infectious disease, these contained places is the infection spreads more. Now the numbers, I think yesterday from New York City Rikers, for instance, is way above China, way above Italy. So if you have a coefficient of 0.5 for Italy, in Rikers is small, it's 2. So it's basically some fold. I mean, it's everywhere in the world. When you're in a prison, then the spread of the infection is high. So I think there has been some considerations how to handle this, because protecting the people in there is a different measure than your correction strategies. So I think this is also a very important issue, and these people don't have most of the time access to proper healthcare.
Perfect. I think I'll say quickly 2 things that are also vulnerable. We're thinking, a lot of people are leaving the cities. I think in economic crisis of 2001, I remember already, and I've seen it in other times, that many people in Istanbul will pack up and go back to their village. And then not always rural areas in, what we hear is a lot of stuff being reported from the main city centers, but we don't necessarily are hearing, or we are not, I don't know if the rural areas of Turkey also are you know, they're going to be faced with some different challenges. We could also, we won't talk about it now, we have to end, but of course, we mentioned Gaza, huge refugee population. We could talk about the Palestinian refugees in Lebanon also, and other places where there are vulnerable communities living in very cramped conditions, with very few services, basic services in Gaza, that they're already, it's a daily struggle for years. But that is something we need to think about also. I want to thank each and every one of you for coming. I think it was so important, and you know, let's all of us keep spreading the word to do what we can, and also remember that beyond us, it's also affecting other communities that we might not be on a daily basis in contact with, or are in contact with, for whatever reason, but now we're confined to our homes. So hopefully that will be a nice way to end this very, very serious global pandemic that I don't think in a few months we could never have imagined that our world would come shattering down in the way it has. So thanks a lot, and I'm going to end the live stream, and let me just quickly end the live stream. So to all our viewers, thanks for taking part, and hopefully we'll be back soon, and I will be trying to get more maybe detailed about each of these places and beyond. Thanks so much for being with us. Good day.